I don't know that AI will ever be able to do that. In terms of medicine, it's right at the beginning. Be you. Don't be anything else. Had I known then what I know now, I would have learned differently. Desire to want to be healthy. If you can do that, the need for much of medicine will go away.
Hi everyone, my name is Irene, Chief of Staff at Oceanside Perspective. Welcome to OP's new series, Finding Purpose, where I speak to professionals who have found their passion and want to share their unique journey, experiences, and learnings with our audience. I'm here today with Dr. Jason Londeree, Chief of General Surgery at Kaiser Permanente's Sacramento Medical Center, who's been practicing here for the past 22 years. Dr. Londeree, thank you for taking your time and having this conversation with me.
You're welcome.
Let's start by talking about your personal journey to medicine. Could you briefly introduce your background and how you got to where you are today?
I don't know how far back, so I'm going to keep the early part brief. Born in San Francisco, raised in the Bay Area, high school like everyone else, went to college at Berkeley. Probably had too much fun there because I actually didn't get into med school the first time. That was a bummer. But I had heard about med school in the Caribbean and St. George's and interviewed. They said yes. So I had a small delay, if you will, getting into medical school, what they now call a gap year. But got in. At that point, I realized I needed to focus more than I did in college. And I did exceedingly well the first 2 years to the point where I could transfer. And then I transferred to George Washington University where I finished med school. So I graduated from there. Part of my desire to transfer was the fact that early on I knew I wanted to do surgery. And I wanted to do surgery in California. Talking to advisors at the time, the only way I was going to do that was to graduate from a US med school. So my drive to transfer, and nothing against St. George's because they taught me very well in my first 2 years, but I needed to transfer to an American school. So I did. Last 2 years there were nothing special. Did well enough that I matched a residency program in general surgery in California, specifically Loma, down in Southern California. I finished there. The program director there actually left in my second year to come work where I currently work. And I had asked him, hey, can I call you in like 3 years because you are now going to be employed where I want to go? And he said, sure. So I did. And they happened to need somebody. I happened to be available. I got hired. And sorry for the obvious, the last 22 years is history.
Great.
So that's how I got here.
Mm-hmm. Growing up, did you have a hero in your life and that inspired you, and why?
I guess I never considered her a hero, and you consider her mom, all right? But mom did an absolutely fantastic job at guiding us and leaving us alone appropriately, such that we could do pretty much what we wanted. Now, if you're asking specifically why medicine, she was a nurse. And she worked on the trauma floor, and she would bring home stories that were just amazing in terms of, wow, I can't believe they did. Oh, he had this done. He came in dead, and they did this. And I wanted to become them. And so from early on, meaning probably around junior high, that's where my focus and or desire to become a doctor started. So that's where my inspiration came from. And I'm one of the fortunate where I have been focused my entire life. So that once I said I was going to do it, I did whatever it took to get here.
Mm-hmm. Was there a pivotal moment that convinced you to pursue this career, or is it just a general?
More in general. I cannot remember not wanting to be a doctor. So my mom told me I wanted to be a vet when I was real little. I don't remember that. But I remember going through junior high and high school. Do I remember details? No. But when people ask me, what do you want to do when you grow up? I want to be a doctor. And just focused the entire time. So yeah, did what I needed to do to get here.
How did other people react to your decision to want to be a doctor?
Mixed. In terms of family, everybody was pushing for me. Do what you need to do. One of the biggest encouragement was everybody who didn't believe I could do it. So way back when, I tell this story to some people. I remember I worked at a grocery store during undergrad, putting myself through that sort of thing. And I remember one customer, knew him by name, and he knew, oh, you want to be a doctor? And his response was, oh yeah, good luck with that. And it was little things like that along the way where you hear people, oh, he's just saying that. He's just, and every single one of those was, I'm going to do this. Not only because I love it, but just to spite everybody who said I couldn't. So.
If you didn't become a doctor, what other career would you pursue?
That's actually fairly easy. I would have been a teacher. My passion for teaching, I think to many, is obvious. I love doing it. To me, seeing the light bulb go on when somebody understands what I have taught is one of the most gratifying feelings. Almost everything that I do, I teach. There's very, very few times when I am not home that I am not in an environment where somebody is learning. Whether it is at work, where I help with medical students from 2 different schools. I work with the residents. You're here. Where I really don't teach you, but you know what I mean. And then outside life is the same thing, where I would also probably be coaching for fun, which I've been doing for about 20 years as well. So I just love to teach. I was a substitute teacher in that gap year, and that was great. Although I never had my own class, I had a small taste of it, where many of the science teachers, I'm not going to call it science, but it could be biology, chemistry, anything. I mean, I had just graduated from college, so did I know those things? That was my major. So yes, I knew them, and I had the opportunity to teach AP Chem class for a week because the teacher was out. That was great. I absolutely loved it. So for me, simple answer is, if this didn't work out, I likely would have become a teacher. At what level? I don't know. My guess is I would have gone back to school, maybe a PhD, something like anatomy, because I love anatomy, and taught at the college and or medical school level. High school was fun, but I needed more people that were focused. So.
Yeah, so this job is kind of the best of both worlds for you.
Yes, yeah, this is great. The fact that we work with residents here, and I've worked with residents all 22 years, and then the med students came along, I think we're on year 8 or 9 now. I don't know exactly, but yeah, they brought in medical students, then they brought in another set of medical students, and it was fantastic. So yeah, it's good for me.
Yeah. So what drew you to general surgery, and why did you choose to specialize in it?
I don't know if you're going to like the answer. It is, I loved working with my hands. So when you're talking about medicine in general and why general surgery above other non-surgical specialties, I've always worked with my hands. My hands are what I do. And when I went through anatomy, I knew, okay, this is the type of doctor I need to be. Something that works with the human body. When I got through medical school, there was no question, based on the experience that I had had, that general surgery was for me. I love the fact that we did a little bit of everything. In addition to that, and this is the part that is not necessarily a good answer, The other specialties, you had to do more than clinical work. The research behind it, the writing the papers, the everything else that is medicine as well, but not necessarily taking care of patients, I had no interest in at all. So like research and me do not go together. And so getting into plastics or getting into ortho or getting into anything else that of the subspecialties, I didn't have the drive to do that, nor desire, because it just was not my thing. I'm sorry to every doctor out there. I hate research. I can't stand it, and I don't like it to the point where it just wasn't for me, and that is needed in the other fields. So that's, I don't want to say general surgery was a fallback, but general surgery was something that I could do in California at a hospital like Kaiser, where we here in Sacramento are very in between in the sense of it is not academic. It's a private hospital, community hospital, but we work with residents. And so that was very much a bonus to me. So that's why general surgery.
So let's talk about some advice for aspiring physicians, starting with how does someone know that medicine is the right path for them?
Put very simply, nothing else matters. It sounds too basic, but you have to take medicine as a way of life. And again, I've said this to many people, it sounds kind of corny, but a surgeon is not what I do. A surgeon is who I am. I mean, this is life to me. And in my opinion, if it's not going to be life to you, it's not worth it. Now, do I live to work? No. All right. I work to live. I love my life outside of working. But at the same time, I enjoy coming to work every single day. For somebody who's up and coming, that was for me. But if I have to give advice to somebody, it shouldn't be a thought. You shouldn't think, should I do this? You should know, I'm going to do this because this is all I want to do. If becoming a doctor is just a thought, or I'm doing it because there are 6 doctors in the family and it's expected, I think you're just going to be miserable. It is not worth it. Life is good, but we do work hard. So it's just not worth it if you really don't love it. So the easy answer that I think I came up with there is you shouldn't question yourself. You should just want to do it. I can only tell you a minimal amount of experience I have with my kids, such as my oldest daughter, who quickly flirted with the idea of, I might take the MCATs. And the next day said no. and again, she had firsthand experience of what it's like to be me. And it just wasn't worth it to her. So you have to have that drive. And of my 3 kids, none of them have expressed any interest whatsoever. Now, have I pushed them? Never to be a doctor. I just tell them, I go, do what you want, be a useful member of society. But I think the drive to be a doctor shouldn't come from anywhere else. It needs to come from you, and it shouldn't be a question.
Yeah. What quality or experience do you think med schools are looking for today that might set someone apart from the others?
I think people who are genuine would be one of the characteristics I would be looking for. I don't have a lot to do with entrance into medical school. I have seen some things into residency programs. And for the most part, somebody who has a little bit of life experience, I think being able to work with people and having that life experience is a huge benefit to becoming a doctor. Because if you do not know how to talk with people, if you can't be you and take care of people, then no. To me, that would be one of the most important qualities. Along the same lines, being part of a team. If you are not a team player, medicine is not for you, because there are very, very few times in any specialty that I can think of that you are solo. You're always working with other people. So team member, being varied in life, just, that life experience I think is huge now. Again, there are many out there, research oriented, who would say, giving back to medicine is hugely important. I don't have that experience, so I don't know how important that is. This is just coming from a non-research, community-based, who works with a prestigious university, who has residents that are absolutely phenomenal. So I have seen the CVs of some of these residents coming through, and they are the most impressive I've ever seen. It is absolutely incredible how many different things, from research, traveling to Africa, working with this, and I mean, it's all out there. So do a little bit of everything. Give yourself an experience, a life experience, and at the same time, keep pushing towards med school.
How much do you think luck plays a role in this process?
None. So I can't think of any other way to put it, so I apologize. I busted my ass to get here. And every single step of the way, it sounds horrible, maybe sounds conceited. I believe I earned it. No handouts. It's work. And you just keep pushing. You have to keep working. And as far as the luck part of it, I don't believe it's really a part of it at all. If you work hard enough, it will happen. And med school now is different than when I got in. It's even harder now. So you really have to work hard to get in and to make it happen. But if you keep working, you don't give up, it will happen. So you just have to want it bad enough.
Yeah. What's a piece of advice that you would give to your younger self?
Don't fool around. The only thing I regret, and it is part of my life experience. So I take the St. George's thing that I talked about earlier. Didn't get into med school. Whose fault was that? No one but my own. All right, why? Wasn't focused enough in my undergrad. So if I were going to change, it would have been great to know at 20 what I knew at 28, which is when I started. I think I was 28, 27, 28, so long ago, when I started residency. To know what it takes to get there would have been nice. I would have tried harder. So that's, I wish I could change that. But at the same time, would I go back and do it all over again the same way? Sort of. All right, because my experience in Grenada, where St. George's is, that was phenomenal. I mean, you talk about growing up quick, because all of a sudden it's you. And so there is no one else there to take care of you. You figure it out. And so I grew up very quickly, because I was at home at undergrad. So home wasn't like when you're growing up. For me, when I was in undergrad, I was totally free to do whatever I want, whenever I want. So it wasn't like living at home like most people. But actually leaving the house and truly being on my own was a huge experience, that I don't want to give up. So
moving on to talking about your current working life, what's your favorite or most satisfying part of your job, and what do you like least about your job?
Most gratifying is to see the patient on the other side. There are times when you see somebody who has, whether it's a small or a big problem, they have a problem, something that I can fix. And again, with my hands. You go and you fix them. To you, it's not a big issue. It's just part of what I do. But on the flip side, the patient, all they have is a huge smile. I think you saw that. All right. And it doesn't matter how insignificant the surgery may seem, it is just so gratifying to fix a problem that a patient has. They come out the other side and all they're doing is smiling and saying, "Thank you. I can't believe I feel normal again." So that's the best part of the job by far. The worst part? No, what don't I like? This is coming from an admin sort of perspective. Chief of the department is not a big deal. I hate to put it this way, but essentially I'm a glorified babysitter for adults. Um, and no, I don't hold them on the hand and this and that. I just make sure everybody stays in line. And there are times when working to get everybody to play nice is the part that I don't like. So, and that's with almost everything. I mean, I know that's this job, but I can tell you the same thing for coaching too. All right, when I go there, I just want to coach. So and so is misbehaving. I'm like, have somebody else deal with it. All right. So, but yeah, that's probably the worst part is just making sure that everybody else gets along and they play nice. I hate to put it that way, but everybody knows what I'm talking about.
Yes. Do you have a favorite procedure to perform?
Oh yeah. So laparoscopic right hemicolectomy. That's an easy one. So taking out the right colon through little holes. It is challenging and fun. And it is one of the cases, one of the other reasons I like it is from a resident or teaching point of view, I should say. The residents acquire laparoscopic skills in their probably second year is where they start getting reasonable. And it is one of the cases that is perfect to teach because the number of things that can go wrong, do they exist? Yes. But obviously with proper guidance, they can be taken through the entire thing and actually do the case, feel the satisfaction of having, I did this, not I, me, I, them. And that's just another, that's another good feeling. Again, I told you earlier, is that light bulb going on? It's fantastic. When somebody comes out of a case and they say, I did this, I can do this. And I'm like, yeah, you can, keep practicing. So.
How do you maintain work-life balance? From my perspective, work-life balance has at least two components, being work and family and work and health. So how do you balance work and family?
Work and family is pretty easy, especially working at Kaiser. All right. One of the big advantages of Kaiser, I stated this a little bit earlier, most of us here don't live to work. We work to live. And we have a great advantage here, especially in my department. One of the things I have tried to create, again, is a team approach. When we are on call, we work. And if there's something left over, you just do it. You don't say, oh, so-and-so passed this on and so-and-so passed. We just work. We cover each other constantly. And what that allows is that when we're not working, where am I? I'm at home. All right. There are other ways you can balance your schedule so that you can make most things. So with family, in terms of growing up with the kids, I have 3 kids. My baby is now 21. Yeah, 21. How many things did I attend while they were growing up? My guess is 85%. Were there things that I missed? Yeah. All right. Some week-long things I missed, but at the same time, they have their week-long field trips in 6th grade. They have another one in 8th grade. I went to half of them. Why? Because my wife went to the other half. We actually split them. As long as I know in advance, I can ask for time off. And I spent those weeks with them that were fantastic. Sports-wise, I made most major events. I don't remember missing any of them. It's the job. It's Kaiser that allows me to do that. The way we can balance our schedules and simple things. It's not a family thing. I have to go pick up a car today. All right. My last patient is at 4:30. I'll make it. I have time at the end of the day. I'm supposed to technically be here till 5:30. But the last part of my day is for charting and such. And so what has Kaiser done that allows me to do that? I have a computer at home. So I race out when it's time. I take care of, and I know we were talking about family, but this has to do with life. I race out after my last patient. I take care of what needs to be taken care of before the place closes, and I go home and I finish my charting. All right. I did that for the kids as well. There will be times where they have a water polo game at 4. I'm like, get everybody here really early. I'll do my charting when I get home tonight. And so having that computer at home is huge. So it allows flexibility of our schedule so that we can make these things pretty easily. So it's a good balance.
Yeah. So work in health, I know that you're very active and into fitness. So talk about the physical toll of being a general surgeon.
The biggest problem is not moving for a while. When operating, there have been times in the past where, again, I'll come back to the right hemicolectomy. If I'm doing it by myself, I'm moving a lot, and it takes me hour and a half. How many times am I working by myself? Never. All right, I'm always working with the residents, so it takes a little longer. And the problem there is they're doing all the moving, and I'm not moving as much. When I was younger, not a problem. Now, I got to move a little bit more. But it's really easy to accommodate for these things. The health part of it that you were talking about, yeah, I wake up at 4:30. All right, I go to the gym every single day. So by the time I get to work, I am loosened up. I am ready to go. And so it's not an issue. So physically, I can handle it and it's not a problem. If I have a hurt body part, such as my back right now, all right, then it's very easy, especially in the operating room, to stop what you're doing for 1 minute and move around and then get right back into the case. One of the things they actually have looked at is injuries, and common injuries among surgeons, and things like necks and backs are at the top of the list. So has it caused my back thing? I don't think so. But just keep moving and you'll be fine. I don't really think it's a big issue in the sense of it's not that you don't have time, you just have to make time. And it's not any different than any other profession, because you look at my basic work life and I am here either at 7:30 or 8:30 and I am done 5:30. That's not the whole day. All right. If you ask most people, when do you work out? It's not between 8 and 5. It's before your day starts or after your day is done. So I just do exactly the same thing. And when you ask about the health part of it, I've been doing it so long that I would miss it if I didn't do it. So for me, it's a very easy balance.
What are some of your hobbies?
Lots of stuff. So if it has to do with hands, I like to do it. Along with a lot of people, I got into sourdough baking during the COVID time because nobody could go anywhere. And I have kept it up to the point where I very rarely eat bread that I don't bake myself. Almost every other weekend I will be baking. It's one of those things where you can work it into what else you're doing. And the what else I'm doing is talking about, am I woodworking for the day? Am I water skiing for the day? I like to do both, and I do both all the time. So water skiing, I've done it forever. So I have no idea if you have one in your camera. No, you don't. I have them all over my office. But water skiing, huge hobby. Recently got into sailing as well. That's fun. The woodworking thing, I love to build toys. You just make it, kid plays with it, and it's great satisfaction. For the most part, I'm not like a furniture builder or things like that. I make things that I believe are useful. What are you going to do with it? So as opposed to have it just sit there and collect dust. I have learned to sew and weld. Those are the big things. Love gardening too. Home improvement. Built my own kitchen. That was part of the woodworking thing. Yeah, so you can mix in some electrical and plumbing in there too. I would be a fantastic handyman. So, but yeah, I dabble in many, many things. And yeah, if it involves my hands, I have tried it.
Yeah, that's great. So as chief, you have a lot of administrative duties. How do you advocate for patient care as an admin?
For me, it's real simple. Admin is just see the patient. In that, what we do from an administrative point of view is try to make the clinic as efficient as possible, try to make the doctors as efficient as possible so that we can see and take care of as many patients as possible. When it comes down to it, I tell everybody, remember, just take care of the patient. We'll worry about the details later. If there is some detail that I need to fix to allow one of us to do what we need to do to take care of a patient, that's my admin part. And something from as simple as who sees which patients. I just got done doing that with one of the docs now. He's revamping the list as we speak to provide for the two new docs that are starting this month, so that we can have them start in a nice streamlined way. That way they're seeing the patients who they're supposed to. So from an admin point of view, that's primarily what I do, is try to promote everyone to be as efficient as possible so that we can get the most work done in the smallest amount of time, basically, so you can go home and balance family work life, so you can make all those kid things, so that you can maintain sanity, so that you want to come back tomorrow to a job that you enjoy.
Our nonprofit organization, Oceanside Perspective, focuses on our core values of L.I.T.E, leadership, innovation, technology, and entrepreneurship, most of which play a significant role in your work. So starting with leadership, when I first started shadowing here, one of the first things I noticed was your passion towards teaching and mentorship. You're constantly surrounded by students, from shadows to med students to residents, and you have bags of snacks in your office to feed all of these children. Outside of work, you're also a swim coach. So when did you start teaching, and how did your passion for teaching start?
I started teaching probably in high school. I enjoyed helping people, and it's a way to solidify that you know the information yourself. I started very informal in high school, where everybody helps everybody else. I was the science geek. Ask Jason, he knows. And so I would attempt to teach as early, like chemistry, AP Chem, bio, sciences. That's what I could do. And just help others informally. Undergrad, I remember the same thing in anatomy. That's the only thing I was good enough at to teach. So afterwards, my substitute teaching, it was great. Again, seeing that light bulb turn on, even though most of them didn't care. That was high school, sorry. Was still a good thing. I really got into teaching in med school. So when I took anatomy, I absolutely loved it. And so I became a TA. And I think I spent more time in the anatomy lab as a TA than I did when I was taking the class. And so that was absolutely phenomenal. And that was my first real, these people are looking at me to help them. I loved it. And so, so that was first part of medical school. Second part of medical school, I became a learner again because I had a lot to catch up on. And then getting into residency, when you're at med school, you're working with students as well. And so my teacher role started up again, and I have just never stopped. So from then till now, I have been teaching clinically. There isn't a time that I'm not. I added to that my teaching. I swam when I was little, and so when we put our kids on a swim team, I was team mom, if you will. For the first year I was there, and I complained a lot. And I was like, why don't we do this? 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 And at the end of the season, they asked me, do you want to coach? And I've been doing it since. So teaching a little kid to get across the pool for the first time, I become a brand new parent every single year. I'm an absolute basket case watching the 3-year-old go all by herself all the way across. And everybody's like, she's so little. I'm like, yes, I know. I don't know how she's doing it, but she listens and she does what we say. So, and it's just an absolutely fantastic feeling to get them to do what they're supposed to do.
I also taught anatomy at UC Davis after I graduated, though, so I definitely relate to the teaching, the passion about teaching.
Yeah, no, I am very, very proud to say my daughter, the one who, she just finished PT school, her first part of her job was getting, is one day back at physical therapy school in the anatomy lab. So she's in the anatomy lab teaching that which she just learned to all of the brand new physical therapy students. She does that one day a week along with her real job. So it's really cool. I was just like, so proud papa moment. So
Yeah, that's awesome. So what kind of mindset do you try to instill in your students and why?
depends on which students you're talking about. If we're talking med students, the easiest concept, which is really hard to achieve, know everything about your patients. You absolutely positively must have curiosity in everything. One of the most important questions I tell them to ask at the beginning of the rotation is why. I want you to think like a toddler. Why? Well, why? Keep asking. And if you ask all the time, there will be many questions that you will be looking up to answer that question for yourself. Clinically, that's why we need medical school, because those answers aren't in books. Why do I feed a patient who just had a colectomy this as opposed to this? Based on my experience, blah, 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 blah. That's the answer. It's not in a book. So that's what you learn when you are here. So curiosity, I think, is huge. You must absolutely positively have a desire to learn. If you do not, it is not worth it. Don't go into it. All right. The quest for knowledge, if you will, sounds corny. It's a real thing. All right. You have to want to know more all the time. If you are ever happy with just knowing enough, this is not the right place to be.
Mm-hmm. What's a quality that you see in your students that makes you think they're going to be a great doctor one day?
I like answer similar to what I gave for med school. Be part of the team and have that curiosity. I had a student, just finished with him, sent me a text, and on his evaluation, I put you, or he, because I was writing about him, I said, he is why I like to teach. His curiosity, his fascination with everything, his, again, I hate to use the analogy, his 5 or 6 year old curiosity about everything was just fantastic. It was a pleasure to teach him because of the interest that he showed in everything. The most important part about it, I believe, about him was that it was so genuine. And it was just a treat to have him come in and just like, hey, all right, you're here today. What are you going to do today? He goes, can I hang out with you? I'm like, of course. So.
One of Oceanside Perspective's core values is intergenerational learning, where people from different generations exchange knowledge with each other. Many students from various generations have learned from you throughout the years. What's something that you've learned from your students, and could you provide an example?
Patience and how to teach. The most important technique in teaching, if you try to teach a particular concept, technique, it doesn't matter. And all you have is deer in the headlights. Don't say it or teach it the same way again, because the result is likely to be identical. Whenever you teach, if you see that you're not getting through, say it a different way. Teach it a different way. Because not everybody learns exactly the same way. You absolutely, positively must be variable or have the ability to change how you teach so that you can teach everyone. If you can't do that, don't be a teacher. An example would be one of the things I like to teach. I think this might qualify. Back to my favorite case, right hemicolectomy. When I am telling a resident how to, the colon is attached to the lateral sidewall. We have to make it unattached. You can work from top to bottom, or you can work from bottom to top. If you are looking at the screen, to the right is not to the patient's right. It's actually toward the head. So have I thought of different ways of telling people or teaching people which way is which when you're on the inside of the belly looking at a camera and you have nothing but your internal organs to orient you? Yes. Go up. Well, okay, up is a bad way to put it, because what are you talking about? Up towards the head or up towards the ceiling? Or up towards the field that you're looking at? So that's a great example of, you have to have because not everybody is going to learn the same way. You have to be able to say, when I say up, this is what I mean. When I say right, this is what I mean. And then use different ways of teaching that so that everybody gets it.
One thing that I've also observed from you is that you give great feedback that people accept and are responsive to. What's your feedback style, and have you honed this skill throughout the years?
Well, this is kind of horrible. I'm just blunt. I've never been anything but blunt. We're talking about adults most of the time, but I do the same thing with kids. I don't coddle anyone ever. So I can give you a for instance. My current med students, I told them on day one, any patient that you ever operate on, you need to have a note. What sucks about surgery? We start early. So if you are operating at 7:30, you need to have seen your patient and written the note by 7:30 or 7:25 or whenever we're going to meet. Okay. Didn't happen. And so I tell them, were you supposed to do this? Yes. Did you? No. You going to do it again? No. Blunt. I do not sugarcoat anything, ever. I find that the best way for somebody it's just tell them. Don't hide this. I don't try to be anybody else. I say this all the time. No matter how blunt I am or how mean I may seem, they keep coming back. So I guess I'm not doing anything wrong. So, have I had individuals that didn't respond to me? Yep. Worked with me for a couple of weeks. Was supposed to work with me for the next several months. Never did. Didn't like my style. And unfortunately, I am somewhat conceited when it comes to this part of it. If they don't like my style, they don't have to work with me. So, because, I apologize again, I've come to a point in life where it's my way. So, do I bend? Yes, I do. I can tone it down a little bit if I need to, if I feel that I need to, but for the most part, I just be me. So.
Yeah, and I think the authenticity, and you can feel it.
Yeah.
And I think that's why people are responsive to it.
Yeah, there's just no question. It's just like, do this. Why? Because you're supposed to. It's just how we do it. So.
Yeah. So, being that you're one of the doctors I followed around for a while or a bit, what feedback or advice do you have for me to maximize my potential?
This is advice that I give to everybody that I work with that I feel has the potential to be one of us. Be you. Don't be anything else. Never try to be anything else. When you are in front of patients, they can tell. They can tell if you're putting on a false face. If you go in and you be genuine, just be you. This sounds horrible. I'm a garbage mouth. I behaved myself for this, but usually I would use more creative words. All right. Have I done that in front of patients? I'll let you answer. What do you think? Yes, I have. Now, do I get a good feeling about that patient before? Of course. All right. You learn to read people really quick. But you have to be you. I mean, don't try to pretend. Don't try, because you're just going to be miserable. It's like, oh, I got to go and do this again. As opposed to, I'm just going to go and be me. All right. The comfort with talking about anything comes with time, but it is so much easier if you go into a room knowing that you don't have to pretend to be anybody else. And people will like you for who you are. You just got to be you. And that, again, that's why in terms of the curiosity, it's just like, are you curious about what medicine is about? Yes. All right. Put simply, and I apologize, you are the most curious shadow I have ever seen. All right. In terms of just your drive, it's fantastic. So keep doing what you're doing.
Oh, thank you. That's surprising to hear. Yeah.
No, it's a matter of the interest. And did you, I know how you got here. Did I necessarily look for you? No. I had an interesting case one day, and I was like, can I borrow her? And you quickly said, ooh, can I do that? And since then, I believe you have taken off not only to me, but multiple other docs. Do you think we did that? No. We allowed it to happen, but we did not initiate anything. All right? So just be you, be genuine. Don't try to be anything else. And I think the response is, if it's going to happen, you're meant to do it.
Thank you.
Mm-hmm.
Now let's talk about innovation and technology. Mm-hmm. There's constant changes, breakthroughs, and advancements in medicine. How has the industry in the field of general surgery changed since you began working in it?
A lot. I learned how to take care of breast cancer during residency. When we came out of residency, lumpectomy, mastectomy, those were basic, and that's what we did. Since then, plastic surgery has come in, started doing the reconstruction. Their reconstruction has become more complex. The mastectomies have become more complex. I did one type of mastectomy when I started, a simple. Now, after that, we started doing skin-sparing mastectomies, where we left some skin behind so that it can be reconstructed at the same time of surgery. I have done at least 6 or 7 different types of incisions to remove the breast. Most of that because of plastic surgery. After that, nipple-sparing mastectomy. So we leave all the skin behind. These women are exceedingly happy if they are a candidate, and we can provide them with a cosmetic result that's absolutely phenomenal. It was a skill that I learned along the way. Somebody asked, do you think you can do this? Yes, I can. I watched one. Now I've done several hundred. I did a ton of hernias while I was here. Now I don't do so many anymore because 3 of the younger people are now doing them on the robot. And they can do it better on the robot than I can just with the laparoscope.
Do you think there's going to be a shift towards robotic surgery?
Definitely. I think robotic is going to replace laparoscopy. When is it going to happen? My guess, 5 to 10 years. Everyone that we hire from here forward, I'm thinking will have robotic experience and will want to work on the robot. I have been told, I don't do it myself, but the 3 robotic surgeons we have here, it's just easier, quote. The problem is, it takes 3 times as long. The setup, getting through the case, just takes longer. Part of it is experience. So we may use laparoscopy or continue to use laparoscopy for the simple cases such as appendix, gallbladder. That's about it. Those middle of the night cases where the robot was essentially a waste of time. But for anything complex which requires manipulation on the inside, I've seen it. It is absolutely phenomenal how much easier it is to move, and I think it will replace.
Do you think AI could eventually replace aspects of your job and change the way that you do patient care?
I had a patient, history of breast cancer. She had a recurrence on one side, She had a new breast cancer on the other side. Will AI see her and know, without even talking to her, that she wants a bilateral mastectomy? I walked into the room. I said hi. I looked at her face. I knew where we were going. Can I say that 100%? No. But I asked her within the first minute, and I was right. I don't know that AI will ever be able to do that. But I also don't know everything that AI can do. So it's in terms of medicine, it's right at the beginning. We have used AI in information gathering, and it was pretty amazing. 95% accuracy or better. In terms of clinical decision making, it could be helpful. Will it replace? I don't think so. I think there's too much human factor to replace.
Best case scenario, it's going to be a great tool.
Oh yeah.
Yeah.
Oh no, definitely a great
Even
tool.
though the medical scribing might not be a thing in the future.
Yeah, exactly. I mean, it's just your conversations are listened to and your note is created. That's what exists right now.
So lastly, the future of medicine. What is something that you wish medical education and training emphasized more?
Putting everything together. I know you have to learn the individual parts, but one of the most important ideas I try to teach all the students is when they come here, the information they have in their head is just this nest or bundle of wires that has no sense to it whatsoever. My job, straighten them out, make it all make sense, because all of it occurs under your skin. It is all part of us, and putting these things together so that they make sense. I wish there were a way to make it make sense earlier on so that when you are learning it, you've got a story to tell as you go, as opposed to just a multitude of facts. Had I known then what I know now, I would have learned differently. So how do you create that sort of curriculum? That's tough.
Yeah, that was one of my biggest struggles when I took anatomy and then taught it, but then still the big picture and how everything connects together is the difficult part.
It's, yeah, in anatomy, one of the most important things I learned was it's not this is this and this is this. It's the majority of this is right here and the majority of this is right here, and they meet in the middle at this point. One never ends and the other begins. It is just fluid from one to the other. So, and there's many parts in the body, or actually all parts of the body, that are exactly like that.
What is the biggest healthcare challenge that modern people are facing, and what can people do to prevent it?
I don't know if this is a good answer or not, but taking care of yourself. You will get the most out of medicine when you care about yourself. I think the biggest challenge is getting people to care about themselves. If you can do that, the need for much of medicine will go away. And if we could instill in every single young person out there the desire to want to be healthy, then it is so much easier to take care of people. I mean, just do what's right. The diet and exercise is part of that. You've heard me, unfortunately, talk about KFC. Do I love it? Yes. Do I eat it all the time? Maybe once a year. Why? Because I know it's horrible for me. All right? Doesn't mean I can't like it. So, but I try to do what I'm supposed to do and take care of me. So simple steps. Yeah, you just have to take care of yourself. I mean, walking for 20 to 30 minutes a day, making sure that you balanced diet, all of those things are just, does it take some work? Yeah, but where's that work come from? Personal desire. You just have to want to do it. So you can figure out a way.
What does the future of medicine look like to you?
That's a great question. And I don't know. I hope that the Kaiser model actually becomes bigger, where it is just it's easy for everybody to take care of themselves if they want. All right, is it going to take care of everybody? No, because not everybody wants to take care of themselves.
Thank you for this conversation, Dr. Londeree. As someone who has yet to find her place in the world, I feel very privileged to speak with someone who has found their passion and vocation and is willing to share their experiences with me.
My pleasure.
Dr. Londeree, thank you for opening doors, literally and figuratively, for me as a shadow. Without your encouragement, I might not have been able to shadow so many doctors and see so many rare operations. You guys have fostered such a beautiful environment and culture here, and I'll definitely miss it a lot once I finally leave.
You're welcome to stay as long as you like. So.
Thank you again for this
You're welcome.
opportunity and discussion, and I wish you and everyone here all the best.
Thank you.